There are 4 types of venomous snakes in the United States: rattlesnakes, copperheads, cottonmouths, and coral snakes. It's important to know what snakes are in your area so that you can be on the lookout for the signs that may be caused by a snake bite. If you witness your pet being bitten by a snake or even interacting with a snake, there's actually very little you can do in the way of providing first aid. Try to get a picture of the snake, taking care not to get bitten yourself. You don't have to get very close for identification purposes. Now, you may have heard to apply a tourniquet to a snake-bitten limb, ice to the affected area, or even to try to suck out the venom after lancing the area. None of these are recommended in people or pets. You're going to want to transport your pet to the nearest veterinary facility as soon as possible, where they can help you identify what snake may have bitten your pet. Even if your pet isn't showing any signs of a snake bite, you want to transport your pet to a veterinary facility as soon as possible, as in many cases it can be difficult or even impossible to identify the signs of a snake bite. Now, obviously not all snake bites are witnessed, so you want to become familiar with what type of signs may be caused by the snakes in your area. In general, there are 4 toxins contained within snake venom, and any one snake can have more than one of these types of toxins. Neurotoxins can cause muscle fasciculations, or more commonly, weakness, which can progress to paralysis. Cardiotoxins can cause abnormal heart rhythms or stop heart function completely. Cytotoxins can cause local tissue damage and destruction, which can be seen as swelling or bruising of the affected area. And finally, hemotoxins can cause red blood cell destruction, which can lead to anemia, or blood clotting disorders, which could be seen as bleeding from the bite site. It's always important to watch your pet's behaviors and monitor her vital signs, and if anything is abnormal, seek veterinary care, whether you suspect a snake bite or not. Pets that have been bitten by a snake may need antivenom, fluid therapy, pain medications, or even transfusions. In some cases, multiple vials of antivenom are needed, while in other cases, no antivenom is necessary. Your veterinarian will make recommendations based on your pet's clinical signs and the progression of those signs. Again, in some cases, signs of a snake bite are not obvious, but if you know your pet's been around a snake, it's important to get her monitored by a veterinary team as soon as possible, generally for a day or so.